Hi, I'm Robin, Director of Avanta Healthcare. Today, I'm joining with Dr. Rinki, Anesthetist and Intensivist of Avanta Healthcare. Today, we'll be discussing about critical rehabilitation center. As Dr. Rinki, you know, many of the people have lot of doubts about rehabilitation center. So, can you please explain about the rehabilitation and what do you mean by critical care rehabilitation?
So, critical care rehabilitation is a multidisciplinary approach wherein we optimize the physical condition, the cognitive condition, as well as the emotional conditions of a patient who has been critically ill. It could be a patient who has been having some infection for a long time and required some ventilator support, some dialysis, or it could be some patients like those who have polytraumas and they would have undergone so many surgeries and they would have been in the ICU for a long time. So in this, basically, we just do not do, we continue the care what has been given in the hospitals. Like a lot of patients we get are unable to get off the ventilator in the hospital in spite of long stay in the hospital. So those are the patients who are called as prolonged wean or difficult wean. So we get those patients and we continue the work of what has been going on in the hospital to wean off the patient, take care of the rest of the medications, and continue the care till he or she is totally independent.
Okay, so you meant to say that we can take like critically ill patients who require continuous attention or who are in ventilators or who require inotropes and all kind of sorts of care also can be continued in the rehabs or
Yeah, we can, as in it has to optimize. The patient has to come down to a certain extent because we lack multi disciplinary support, as in multi specialist support. So probably yes, we can after a certain extent, and when they are optimized to a certain extent, we can continue. And mainly it will prevent us to readmissions to the hospitals get prevented because we continue the care and that takes care of we just take care of things the way it should be. So for small reasons the patient doesn't have to go back to the hospital, and at the same time we can start the rehabilitation part for the patients, as in the physiotherapy stuff begins, the speech therapy, the swallow therapy begins. So we kind of prepare them to come back to normal.
okay.
So that is the journey which starts from the critical stage till the patient comes to normal.
Okay. Ma'am, other question what we get from the patient is like when they come to Avanta, they come with lot of hopes. So how do you think like what are the goals we can achieve in a rehabilitation center and what are the things we can educate the patient like what they have to keep it in mind?
All these patients are critically ill. Most of the times we opt for the critically ill patients. So, patients who has critical illness polyneuropathy are one kind of patients which whom we get very often, and these are the patients who has had some sepsis and post sepsis. They've gone into this critical illness polyneuropathy. It itself takes, the body has to recover. It takes around 6 weeks for that to recover. So, and most of these patients would be the patients which whom we could not have weaned. We need to work on it. So definitely our goal is to improve the outcome, and we need to support the patient with various things: nutrition, therapies, and the ventilator weaning strategies, and everything. Every day we give trials of how to. We have a plan, and we move towards our goal of extubation and how to sustain post extubation. So it takes its own time. It is not. It is patient to patient. It differs. Although we do have a frame of 6 weeks for the CIP patients, so we should educate the families and make them realistically understand what we are doing and what is our goal. So we will be able to stand up to the expectations when everything goes fine. Whereas there would be many chances that things wouldn't fall into place. Many complications are expected to come every day.
Yeah.
We have to tackle those. And for that, we need a lot of support from the family. Family has to understand with us what we are doing and they have to cooperate.
Yeah. So, so when it comes to a goal, as you said, like we have different goals of like reducing the infection rates, getting the patient out of bed, so getting the patient out of ventilator. So it will all takes its own steps.
Yes.
So we have to educate the family about all these steps so that it will be easy for them also to understand the time of journey or how the
Right,
process will
right,
happen.
right,
Correct.
right.
Good,
So
good.
time plays a very important role here.
Mhm.
We need time. I mean, we cannot push a patient. Patient has to recover.
Okay.
So we have to figure out what is the reason that he is not being able to improve, and we have to work on it. And this is rehabilitation. This part is the rehabilitation part. So we have to understand whether there is a nutrition deficiency, if there is an systemic problem which is causing us, I mean, which is hindering us from going forward. So we have to treat the cause. So this requires a lot of troubleshooting on a daily basis, which will take time, and that's where we need the support from the patients' families, because most of the times these patients would have been in hospitals for a very long time and they would be drained financially. So we do. I mean, it is possible to do things which is financially compatible to them, and continue the treatment. That is what is our goal.
Okay. Okay. Good. Good. Yeah, as we discussed about the previous things, I have a few more doubts. Okay, so when it comes to a multidisciplinary approach, as you said in the previous thing, so what are the components you cover when a patient comes to a rehabilitation center, or what are the areas you cover when you are taking care of a patient?
So first thing is we have to find out if there's any underlying cause because of which the patient has got stuck at a point, like the patient on a ventilator could not be weaned off. There has to be some reason underlying, some systemic reasons, which we as I mean the doctor's team, we would look into it and we would try to troubleshoot and treat it. That's the first thing to do. Side by side, we also need the support of the therapist, like the swallow therapist, the speech and swallow therapist. The swallow therapist helps us to assess whether the patient is having good reflexes, whether the patient is ready to swallow, and it also helps us to plan how to go ahead, and we plan how to decanalize a patient who are with tracheostomy.
Okay.
So feeding with the oral feeding to be initiated, they start working from very early stages. Then we have the physiotherapists who are integral part of the entire program. So mobilizing the patient, making the patient sit up, doing a chest physio every day, which will help us prevent further infection, which will strengthen the muscles, respiratory muscles, to get off the ventilator. All these things is a big support from the physiotherapy team. Then comes our nutrition and dietitian support. So we do personalized plan for every patient, wherein we take care of the diet, which would help us to build up the muscle strength and to get them off the ventilator and later mobilize them, make them stand on their feet and come back to normal. And the last is the occupation therapy. So once these things are achieved, then the occupation therapist works to get them back to the usual. They can get back to their work. So that's how it's a multidisciplinary support, and the doctors team definitely, we see the patients on a regular basis and we keep troubleshooting smaller challenges every day, which is very much required for these critically ill patients who are just out of the critical illness. So these are challenges we face, and it works together as a team.
Yeah.
And even the nursing care, we try to provide 1:1 nursing for these kind of patients. And in the hospitals, the chances of cross infections are very high.
Yes.
But because of the personalized care here, what happens is that the infection rates come down, and each of the things like physiotherapy, occupational therapy, sonotherapy, everything is personalized and customized to each patient.
Okay.
So we work on a customized plan for each patient. Our targeted goals are there, which we try to achieve.
Okay, that's good, ma'am, because I can see that outcomes in like most of the patients who are come here, because I interact with the patients and patient families. They give a good response, like how we take care of them. And we have a home care services, because when the patient goes there, they're not getting an individualized attention. But when they come to a rehab, I think they're getting a teamly approach, and the outcome of the patient is much better. So I think this is the main reason it plays a crucial role in getting the things out of criticalities. Yeah, ma'am, because it is good to hear a lot of knowledge about rehabilitation. I just want to know what are the benefits a patient or patient attender will get if they come to a rehabilitation center rather going home directly or taking a home care services.
So it's kind of the patient who are critically ill. It is very difficult to manage them at home.
Okay.
The first thing that comes is the anxiety of the family. The family wouldn't know how to do, and when they see their own person with so many tubes, they wouldn't know how to handle that. So even if they have an home care, what happens is that the troubleshooting on the day-to-day basis doesn't happen because the doctor doesn't see. But if they come here, first is that we counsel the family along with the patient to reduce their stress, their anxiety, assure them. The assurance gives them confidence.
Yes.
And then next is that we have our own plan, I mean, how to do things. So we have expert team would be able to do it, continue the care. So this basically helps us to prevent readmissions into the hospitals, because it is kind of a continuation, and the day-to-day troubleshooting happens, and the patient is being taken care by experts.
Yes.
Be it a physiotherapist, be it a nursing care, everything are in expert hands. So this gives a lot of confidence on the side of the patient, reduces the anxiety of the patients, and most of these patients who are there in the ICU for a long term, they end up being into an post-traumatic stress disorder, or they have some psychological issues. They're depressed, they're anxious. So we also address this to start with and assure them. So assurance gives them a lot of confidence, and definitely the outcome becomes better.
Okay.
So this is one very important part. And then continuation of the care till the patient is out of the critical illness, post critical illness period to normal. It's a long journey, which it requires multidisciplinary care. So so all the supports are available in the rehab, and these are all planned on a day-to-day basis, seeing the improvement of the patient, which is probably not possible with a caretaker at home. And most importantly, readmissions into the hospital, the patients tends to get cross infection from the hospitals, which can be prevented here.
So you meant to say like readmissions can be avoided because we have a multidisciplinary team, and if any emergencies are there, so we can
We can handle them. Yes.
Because when it goes to home, it will be difficult for them to handle such kind of emergencies.
So we cannot. I mean, once there is an initiation of a problem, we troubleshoot that and we root it out there and then. So it doesn't become big to go back to the hospital. To that extent, it doesn't go. But if it is at home, a lot of times, because there is nobody to, I mean, a caregiver cannot troubleshoot a problem. So a caregiver cannot foresee the problem. So that part goes unseen, and it would come into the notice when it is too big. So we can prevent that, and that's why we can prevent the readmissions.
Yes. Good. Yeah, ma'am. I heard most of the positive things about rehab, but when it comes to challenges, I think there will be many challenges as a doctor or but as a staff they will be facing. Can you please tell me what are the challenges a rehabilitation or the doctors face?
Yeah. So the most important challenge that we face is the lack of super specialist support and super specialist setup, which we wouldn't have in these setups. So basically, if you need a cardiologist or you need a cath lab support for a patient, so that becomes a challenge, because then you have no other option than to shift a patient to a center which has those. And sometimes time constraint remains, because it should be very fast. You do not really have long time to shift a patient. And then I mean, a lot of times small things like if somebody has a small localized infections and other things, that too requires an OT support, which we lack in the rehabilitation center. So those becomes a challenge. That makes us those becomes a challenge, because for these small things we do have to shift the patient sometimes back to the hospital, which we actually want to prevent. So yes, I mean, like super specialist support is something which is becoming a challenge, although we are trying to work over it. However, we do have the super specialists visiting us sometimes, but it's not always possible in the rehab. And the second challenge we have is that some amount of financial support is required to run whatever has been running in the hospitals. So the patient's families would be totally drained after having the patient there in the ICU, especially for a long time. So financial constraint is the second constraint which we have when we have a patient in a rehab center. So I think these are the two major challenges that we have, and we have to tackle that and take things forward in whatever best possible way.
Okay, when it comes to a future thinking, so what are the measures you take as a future strategies for the improvement of a patient care?
Yeah, I am more open to adapting new technology. There are a lot of ventilators which has newer modes, newer winning modes. So we are open to it. We are trying it out, and we are also open to getting new. I mean, any other whatever comes. Newer strategies which is available. People, a lot of things are coming up. So we are just opening to it, and we would want to adapt those. I would want to make the therapy team little more better, more trained. So we are just looking out, more specialized, as in for the physiotherapy, a neurophysiotherapist for a neuro patient, a respiratory therapist working more intensely on the ventilator patients. Those are the things which we have in mind to more intensify the care ahead.
Okay.
And also, as far as the super specialist support and tie up is concerned, so we are trying to tie up with the tertiary centers and trying to make sure that we can reach those patients within the window period to the hospitals in case of emergencies which cannot be managed here.
Okay. So that's a good thing. Like nowadays, like many equipments is coming for neuro rehab or ortho rehab. So it will helping in the better improvement of patients. So we can have a study of all those things, and we can make use of all those things.
Correct.
So I think it will help the patient to improve faster. I think.
Correct.
Yes. Thank you, Dr. Rinki, to give a brief idea of what is rehabilitation. I think many of the pupils, at least they should have got a glimpse of what we do and what are the benefits a patient will get. I think it will be helpful for the patients or who are looking for the hospitals or the doctors who are recurring for such kind of services. I think if you people who are watching this video have any doubts or any clarifications requests further, please reach us to us so that we can help you or we can guide you what are the steps you can take you for a continuity of care. Thank you for watching.